It's the 17th of August 2014 and I'm listening intensely to the radio.
The performance didn't matter today. The victory did. And there it is. England are world champions.
England have just won the World Cup, and from this point forward, women's rugby has been one of the fastest growing sports in the UK. But could it actually be bad for our health? Here's why.
We know that women get concussed more often. It takes you longer to recover, and the symptoms are worse if you're female. And we all accept that a concussion is not good for you. Concussion is bad for you.
That was Dr. Michael Turner. He is the medical director for the International Concussion and Head Injury Research Foundation. Dr. Turner, what exactly is a concussion and how do we diagnose it?
So the diagnosis of concussion is exceedingly difficult, which is why people are so confused. And it wasn't very long ago that most of us thought that concussion was benign. I used to describe it as rebooting your computer. You can reboot your computer ostensibly every day, twice or three times a day without it coming to any harm. And that's what we thought was concussion. You had a bang on the head. It sort of stunned your brain cells, which sort of went into hibernation for a short period of time, and then they woke up again.
So what do we think they are now?
It's quite clear now that that's not the case. Having a concussion involves a whole lot of changes in your brain cells themselves and the metabolism of the brain cells, all of which is being unraveled at the moment.
But the issue is that there's no specific tests and it won't show up on a scan. So you have to rely on symptoms like headaches, dizziness, loss of balance.
It's pretty non-specific, and that's why it's quite difficult to diagnose. People say they've had concussion when they probably haven't, and like us, they said, I never had a concussion, when quite clearly they probably did. Diagnosis is very difficult, and that makes the management very difficult as well, because you can't tell by how you feel how long it's going to last or how bad the concussion is.
Someone who knows this all too well is one of my old teammates, Sam McIntosh. She hit her head in one of our university rugby games.
It knocked me out really, really briefly, probably no more than 3 seconds. I went off eventually and I started acting really loopy and was messing about with the people on the sidelines. And I just remember just from where it was swelling, a growing feeling of okay, that's actually starting to put quite a lot of pressure on my eye now.
Sam had actually been hit in the head by a player on our own team, and she thought nothing of it because we play rugby. It's a contact sport. It wasn't until 4 weeks later, after feeling irritable and dizzy, that she actually went to the doctors.
His theory was that the impact had hit me and my brain had kind of shook in my skull, kind of like if you have a peach pit in a glass jar, it had sort of hit against the side. And he said there's not really much that we know about how that affects the brain. It's not happy. He said, I think that's what's going on. You're just experiencing what we call post-concussion syndrome.
Sam had been suffering with concussion. As hers had persisted, she was now experiencing post-concussion syndrome, which really has no recovery time. And it's been suggested that it can lead to health complications in later life, like dementia. As Sam said, the doctors can't tell you what's going on, because they just don't know. We know even less about whether female athletes, like rugby players, who we know get head injuries more often, are at more risk than men. Dr. Turner is one of the only people in the world looking at how head injuries affect female athletes in later life. His research is looking into ex-professional jockeys, as horse racing is one of the only sports where men and women have competed side by side for years, so you have concussion comparability. So are female athletes being overlooked in concussion research?
You're quite right that the statistics for women's only team are much higher. So the concussion rates are higher in the order of 1.5 to 2 times greater. But if you're looking at female jockeys, then it's nearly 4 times. And racing essentially hasn't changed for 250 years. So we have a cohort of mature women, age 50 and a plus, who are part and parcel of our project. And there is no other project like that in the world, because there are no professional women rugby players who are in their 50s, 60s, 70s and 80s. If you want to look at what happens to women in later life, the best place to look is amongst our cohort.
The reason why women aren't studied more is because there's not enough ex-professionals. As more women continue to play professional sport, more studies can be done. But there are some theories now as to why women get concussed more often than men.
People have tried to explain the difference between the men and women getting concussion. A number of theories were put forward, one of which was that the neck muscles were weak and feeble. Women had swan-like delicate necks, and therefore when you waggled their head on a delicate swan-like neck, their brain got really shaken up and they went into serious decline. And we've not found any evidence that the neck is really the problem.
Do you think it's because of the way women talk about concussion?
The second thing they say is that women are much more truthful than men, and that, you know, when they have a bang on the head and you ask a male jockey, he'll say, you know, I'm absolutely fine, nothing wrong with me. Whereas the female jockey, because she's honest and truthful, will say, I'm seeing stars. And that's absolutely rubbish, because we, again, don't ask questions of our jockeys. We only examine them and do a number of tests that they can't fake. So I don't believe it's the fact that women are more honest. So then you're left with the fact that it's something about being female that puts your brain somehow at additional risks. It's more sensitive to a bang, and that can be due to hormones, or it can be due with your genetic makeup of being an XX, makes your brain a little bit more sensitive to concussion.
But that sensitivity can have devastating effects. Sam, who was doing her master's degree at the time of her head trauma, ended up having to delay it for a year because she just couldn't focus. Her brain wouldn't work, which made simple tasks like reading and writing impossible. She was also told not to play rugby again, as once you've had one concussion, you're more likely to get another.
It's incredibly hard to manage, along with how it affects your relationships, how it affects your social life, how it affects your work. I really thought that if I could use the power of my brain, I could really make myself better by force of will. I really tried to force myself to be better, because I really struggled to accept that I couldn't just mentally push through it. And also for rugby players especially, like, playing is a big part of who we are when we're playing, and it's a pretty tough pill to swallow when someone says you can't play anymore.
As I said earlier, there's very little research into female rugby players and head trauma, but we can learn from other sports like that of horse racing, although granted they are difficult to compare, as falling off a horse is very different to being tackled. Amelia Jones does both, so I asked her how she sees injuries differently in the sports.
Rugby isn't normally as serious. I would say if I was injured in rugby, I'd probably brush it off a bit more than I would with horse riding. Because if you fall off a horse, something hurts, go straight to the hospital. Because it's normally like a broken bone or something like that. With horse riding, it happens a lot less, but it's a lot scarier. You get hurt a lot more often in rugby, but like it's less serious, I think.
Personally, I've been playing rugby since I was 15. I was asked to fill in for school games, they were short on numbers. I ran around for 80 minutes and had no idea what was happening, but loved it and never looked back. Amelia's right, you do get injured more than other sports. I've broken fingers, sprained my ankle, torn ligaments in my knee, and you would say you're crazy, why do you keep playing? Well, it's addictive. It's a sport for everyone and nothing beats your teammates cheering you over the try line. But it does come with injury, and concussion, unfortunately, is one of them. I've had a few in the past and thought nothing of it because it wasn't really spoken about, which is something over the past few years the RFU, the rugby governing body, is trying to change. My university coach, Amanda Jones, works for the RFU as a community rugby coach, and she teaches people about how bad concussion is.
There are a lot of people out there that just don't understand the implications of it. They just don't. You know, part of my job is to just make people aware players' safety comes first. And we all play rugby and we're part of rugby because it's a brilliant sport. And you can't take the contact away because that's what we love. We're a part of contact sport. You are going to get injured. It's just making you aware that you need to put yourself or your players first before anything else. You've probably known from me coaching the university women, I was like, no, get off, like straight away. And some of the players, they don't know how bad it is. To me, it's the players maybe are unaware the effects of kind of concussion.
Amanda's philosophy is pretty clear. If you're suspected of hitting your head, you're off. She even teaches this to other people through the head case course, which is run by the RFU. You can take this course online, which is exactly what I did. It says that concussion is now the most commonly reported injury in rugby, and it also brings attention to its severeness, as it is a traumatic brain injury. After sustaining a concussion, the RFU recommends 19 days for children and 23 days off for adults before returning to play. It also acknowledges the lack of awareness and knowledge that people have when it comes to concussion. Amanda also plays. I asked her if her attitude changes toward head injuries as a player.
Concussion kind of goes to the back of your mind, really. You don't think, actually, I think I hit my head, I should go off. But then as a coach, I'm totally different. Then I'm like, you're off. But as a player, you've got the different pressure of being amongst your teammates. Totally different attitude. I'm really knowledgeable about it, and I still, as a player, would like pretend I'm not concussed and not take myself off. And so it's it is down to maybe the referees and coaches to take that decision away from the players. As a player, I know exactly the implications and I still would do it. It's mad. I've definitely played on where I should have come off.
Amanda put me in contact with one of her colleagues, Matt, who does the same role for her at the RFU. He also coaches, plays and is a referee. He's ref games all the way from the community level to the Women's Premiership. So Matt, as someone who knows just how bad concussion can be, do you focus on it more now when you ref games?
No, I don't think you can, to be honest, because if you try and focus on something like that in a game, you won't perform as a ref. So you can't really afford to do that. But what you are aware of is if a player is clearly affected by any injury, then you tend to be much more sensitive to see what has happened, not to listen to people shouting, hit his head, because unfortunately, in competitive sport, people will try that to influence your decision to perhaps get them from the field. We complete head case every season. So I'd like to think that, we're pretty clued up on what the signs and symptoms look like, and we can make a judgment as to whether that player is affected or not. We're much more aware of what we're looking for and much more conscious to do right by the player.
Matt, again, is someone with a zero tolerance policy. He works for the RFU, so he knows the rules and regulations. If you're suspected of a head injury, you've got to go off. But what's he like as a player?
You don't want to be seen to be that person that says, I'm going to go off. I've taken a knock to the head. Like you say, when you switch codes to refereeing or coaching, you're completely oblivious to that. And you just follow the guidelines. But as a player, you just don't want to let your side down. That point actually is why it's even more important for referees and coaches to be on it. If the player's got the choice, they're not coming off, even if they've got half their head hanging off.
It's that player mentality that needs to change, especially in the women's game, where there is so much pressure to prove yourself as a rugby player, because unfortunately, people don't see it as a sport that women play. It's because of institutionalised sexism that we play on horrible pitches that resemble swamps. We get unqualified refs who don't know the rules. There's no medical assistance. Sometimes there's not even coaches. We play in men's kit, and shockingly, a lot of the time we don't even get changing rooms. All of that adds up to players having to prove themselves and play on through injury. Alan Thomas, you're the head coach of the Reading Kites. What do you think about this?
That's the biggest transition that we've got to get across, is from this, it's a men's sport that women play, to actually it's a sport for all. Yeah, I think it's this machismo, I want to prove that I'm tough to play rugby and I'll play at all costs. Well, actually, all costs is, thank God nobody's died. We don't want that, and I challenged one of my players and said, sorry, but I'm not attending your funeral.
I did feel really self-conscious about having something that no one could see, and even experts didn't really know about, and I couldn't really explain to people. I did feel self-conscious about it. I did have sort of thoughts like, maybe people think I'm just copping out. It's like an invisible enemy, and you can't really describe it to people either. In the back of my mind as well, one of the best rugby players that I've played with was a girl called Heather from Canada, and they had a spate of 2 or 3 girls who got concussed one game and went back to playing 1 or 2 weeks later. They got hit on the head again, they never woke up.
You've been symptom free for over a year now. Would you ever go back to playing knowing that you could get another concussion?
That's the thing that stops me ultimately, and I've been asked by women's rugby clubs to play, and it's really tempting, because the part that you like the most about it is being part of a team, and that's sort of the bonding that you have, that we all had when we played for that team. It never was as good as that, again. With rugby players, we do have a culture of you don't explain and you never complain. Just in that season alone, I broke 2 fingers, I broke my thumb. When it would come to actually putting on rugby kit again and going out and doing it again, I'm not sure I could. In a way, the concussion itself, not the actual hit on the head, the concussion itself sounds really melodramatic, but it traumatized me. The idea that I could have that but worse would be awful.
That trauma stopping Sam from playing again might also be the very thing that's saving her from further brain injury.
Girls get concussed more often. The concussion is much worse. The symptoms are much worse. It lasts much longer, and it takes them, a long time before they return to play. And therefore, you would expect to have lots of 50, 60, 70, and 80-year-old women who are demented in our cohort. And the answer is we don't. That your hormones and your XX may predispose you to be more sensitive to a bang on the head, but it may also protect you.
Dr. Turner's theory is that the reason why girls get concussed more often is also the thing saving their brains in later life. And it's basically that we're women. We agree that one brain injury is enough. We experience them in such an intense nature, and they affect almost every aspect of your personality, that you will do anything in your power to prevent from getting another one. Sometimes that means giving up the sport you love. But is there a way that we can prevent or mitigate from getting them in the first place?
You want to protect teenage brains, and how you do that, is sort of up to you.
The reason why we want to protect the teenage brain is because it's still developing. Head trauma is not good at any age. The brain is not designed to withstand impact, but it's worse in adolescence. As we understand more about the seriousness of head injuries, sports are amending their rules. In football now, you're not allowed to head the ball under the age of 12. And in rugby, the height of the tackle's been lowered to reduce head-on-head collisions. But we know that girls get concussed more often and that we need to protect the teenage brain. So what if we took away the contact element for under 18?
I wouldn't agree with it.
If you waited until you're 18 and all of a sudden you've got to learn how to tackle, I just think that will have a negative effect on the game.
9 is absolutely fine for contact, and the more girls we can get into it, we won't be having this discussion then.
Basically, every rugby player you ask this to will say no. The argument is the earlier you learn, the more confident and comfortable with tackling you'll be, because kids are fearless. Girls often come to rugby later than boys, and learning to tackle when you're older can lead to hesitation. And let me tell you from experience, not committing to a tackle can hurt a lot, and it leads to injury. The only person who disagreed with this was Alan, who coaches the Reading Kites.
Yeah, I mean, I don't see why not, because a lot of women in the game don't play until they're either at university or even much later. I mean, I've got Melly in my team, turned up, she's in her late 20s, never played the game in her life. For us, that's normal. In the women's game, that's normal. It's unusual to have somebody perhaps like you or Nolly Waterman. She played when she was 9 or 10. It's coming into the game at different times. So there will be lots of arguments to that. I mean, I understand that point, but there'll be lots of arguments. They need to get in early. I personally don't see that as a problem for our game. It's proven that you can play rugby and be successful without playing at school, without being 18 years old. Women players in the Premiership today, in the Tyrrell's Premiership, didn't play rugby until they were 18.
I haven't counted, but I would assume that it's a lot. And I'm inclined to agree with Alan. Some of the best players I've known didn't touch a ball till they were over 18. I asked the RFU for a comment on this, but unfortunately they couldn't spare the time. So I think a cap on the tackling age won't happen anytime soon. Although what might be available in the near future is wearable technology. Robert Patterson, not the actor, but rather the director of Orb Innovations, has created a smart gum shield that can give a live feed of the force of impact a player's experiencing.
One thing that we're very specific on is we're not any means able to identify, mitigate, prevent, diagnose these head injuries. Hopefully further down the line, in some form, we can help prevent head injuries. But one of the takeouts might be actually, because it's such a complex injury and everyone responds so differently to it, there might not be a universal or a one-size-fits-all diagnostic test. However, what we might be able to learn from it is that actually concussions typically occur after this set of events or when a player's experienced this. So we can either use that for an educational purposes or we use it to potentially change laws and protocols to try and prevent things from happening.
Dr. Turner is also doing some pretty interesting preventative research around genetics.
You can get a concussion. At the time of the concussion, we can't tell you whether you're going to end up with long-term problems. We hope to be able to do that. And hopefully at some stage, we might be able to tell you whether you are high risk. And that's really the area that we're more interested in. We're not trying to ban sport. What we're merely saying is it would be very nice for you to have a genetic test, a little lollipop in your mouth, which goes off to the lab and says, yes, you are one of those people who has a very high risk of getting into trouble if you have a concussion. Now, that doesn't stop you taking part in sport, but it does mean that you do have a concussion. You might be wise to take another direction.
Although these are still in development, there is one solution that Dr. Turner has that will help people understand the impact of head trauma, and it's informed consent.
Basically, if you encourage somebody as a doctor to go back to sport again without explaining all the things that we've discussed, then the player can sue you.
If a doctor doesn't explain to you in great detail that it doesn't matter if you've returned to normal, once you've had one concussion, you are far more likely to get another, and that might lead to you being unable to play for years or have dementia in later life. You need to sign a consent form saying that you know the risks.
Then it really is your decision. At the moment, quite often, the doctor will see you and say, wonderful, all your tests are back to normal, you're cleared, go on Saturday, it's a big match, excellent, all the rest of it. And that's sort of like encouraging you to carry on and think that you've fully recovered when we can't possibly tell that you've fully recovered. There is this balance between exercise, which is good for you, and sport. All sport involves exercise, but not all exercise involves sport.
Sport comes with its risks, whether it's a contact sport or not. You can really hurt yourself doing a lot of things and nothing's going to be zero risk. Of course, there are sports where it's going to be higher risk, if they introduced a way to play zero risk contact rugby tomorrow, I'd sign up. That's not the way that it is. And at the end of the day, I could walk out of the house and be hit on the head by something else. It's a lot less likely, but I don't think that's any way to live your life. It's not what sport's about.
When I began looking at this topic, I thought that it was historic sexism that meant that there was little research into concussion in women. But in fact, we just don't know that much about concussion. It's difficult to diagnose, to manage and to have, and women get it more often than men. And we just don't know why. Yes, by playing rugby, women are more likely to get concussed. But I don't think that should stop us, because it's a great game, and we're pretty good at it.
England are the world champions.